From the South Carolina Honors College, this is Polluting Patients. If the U.S. healthcare sector were a country, it would rank 13th in the world for greenhouse gas emissions. The goal of Polluting Patients is to teach people about the environmental and corresponding health impacts of the U.S. healthcare system and what we, as healthcare consumers, clinicians, and leaders, can do about it. Welcome to Polluting Patients. I'm your host, Miley Phillips. Today, we will be joined by student doctor Akhil Mandalapu, who is a member of the National Organization Medical Students for a Sustainable Future and the co-chair of the organization's Climate Smart Healthcare team. Welcome to Polluting Patients, Akhil. I'm so excited to have you.
Yeah, thanks for having me.
I'd like to kick things off just with you telling me a little bit about yourself.
Yeah. Hi, my name's Akhil, and I'm currently a second year med student. And then a lot of my interest in the space with climate change and healthcare kind of comes from my origins in Houston, a city that kind of is exposed to quite a few natural disasters pretty much at any time of the year. And I think kind of watching and kind of going through that myself was kind of the spark that led me to kind of pursue this interest of mine.
In your undergraduate studies, did you do anything with looking into like climate smart healthcare or climate change, things like that?
Yeah, it was a little bit more indirectly. I studied public health as my undergrad degree, and I was at a relatively large school, and I kind of found myself working with an urban planning lab. And part of what they would do is focus on extreme heat events and modeling city responses to that. So looking at how can like emergency medical services really adapt to extreme heat events, and how could they distribute resources in the most efficient way to the places that need it the most.
Mhm.
Um, and so I was able to explore it from that side, and then I was also able to kind of explore community health initiatives and kind of tackle it from that side through my university's student-run free clinic. There, I was able to kind of help design some kits for the summer, and then that kind of spawned its own initiative into cold kits as well.
Oh, wow, that's really awesome. Um, and kind of shifting gears a little bit to talk a
Yeah.
bit more about the um, Medical Students for a Sustainable Future. Could you just tell me a little bit about the organization and your role so far and your experience with working with them?
Yeah. So, Med Students for a Sustainable Future, or MS4SF, as we kind of shorten it down,
Mhm.
is a national organization kind of composed of medical students interested in working with addressing the impacts of climate change on health and kind of advocating for changes in this space. And it's started off as a very like student driven organization and still is, but kind of over the years, we've kind of grown and expanded and kind of had different components. And so with that, there's kind of a few different teams involved, focusing on different aspects such as like research, advocacy, policy work, and my team is the Climate Smart Healthcare team, which focuses on what are some initiatives to kind of change the way healthcare is delivered to reduce the kind of environmental impact of the actual delivery of healthcare itself.
So, with the work that your team does, could you tell me a little bit more about different initiatives or things that they're working with so far?
Yeah. Um, so we're kind of focusing on a few different things. S- Something that's kind of it's like a several year initiative or kind of an idea that we're kind of thinking of as our like a moonshot idea is putting together a national climate sustainability challenge, or kind of like a program where we can invite student teams from across the country to get together as a group of 5 to 6 people from different disciplines to design a solution for a particular problem they have noticed in their healthcare system or their university. And the idea behind this is to kind of brainstorm these new ideas on how can we rethink the way we're delivering care. So that's kind of our, several years out kind of vision for what we'd want to kind of work on. Other stuff we've been thinking about implementing is um, a particular passion area of mine is disseminating a lot of the research in the space about how can we optimize the delivery of healthcare from theoretical research to how do we practically implement this the hospital down the street, or taking that theoretical to concrete aspect of things. And we're trying to kind of build some one pagers so that we can help communicate these findings more easily. And finally, another component that we're looking at is with student-run free clinics. A lot of medical schools across the country have free clinics that are run by students and often provide care for underserved populations, and trying to see what are ways as an organization we can support those clinics and kind of having a more sustainable practice of medicine.
I love to hear that. I love to hear about future professionals working towards a better future. So that's all really awesome. Kind of going off of that, from the perspective of a medical student and a future healthcare professional and leader, what do you think the roles of people like yourself and people like myself, undergraduates about to start medical school, are in promoting sustainable healthcare delivery and that kind of thing?
Yeah, that's a really good question, and it's a bit hard to assess because I'm still in the kind of the middle of training and so forth. But I think something that's helpful at any stage is curiosity, and really having that kind of curiosity to understand how are things being done and why are they being done that way. A lot of my kind of background in this space was kind of leaning into a talk that I had attended since I was just kind of curious, since it was being done by a designer by kind of training who works in the healthcare space, and having kind of listening to and being curious about how they think about healthcare delivery challenges was really insightful. And I think that curiosity for any undergraduates or medical like student trainees or so forth can really help in asking the big questions about, why are we doing things this way, and asking like, how can it be done better. I think that's been a very key question to be asking all the time, and it's been helpful in kind of opening up the conversations. And on the other side of things, and sort of just kind of initiating the conversations, a big part of students and trainees is they get to kind of connect a lot of different parts of the healthcare system that may not necessarily talk to each other. And so I see the kind of this curiosity and connection piece as really the two key roles that trainees can play.
I definitely agree. Curiosity is super important. And I think exposing our future healthcare professionals and healthcare leaders to the issue and kind of getting them involved and get people interested is going to be really important. So, shifting gears a little bit away from kind of MS4SF, I wanted to hear a little bit more about your research and things that you've done. Looking at your website, I was really interested to hear more about your perspective that you're looking into with a more sustainable future for healthcare, kind of looking at both the public health side and the role of bigger, more macro factors and the individual clinicians.
Yeah. I think an easy conversation starter is always like, "What? Tell me about your research." For a lot of people in this space, and a lot of my stuff in this space is approaching the problem from different angles. Like I previously had mentioned, in undergrad, I was really taking this macro public health and city planning perspective on things, and really focusing on a big sense of, what are the like geographical factors and resource allocation factors that go into kind of having climate resilience. And then in med school, I've been able to kind of connect with people that are focused more on the hospital side of things. And one of the big projects that I've been working on and helping contribute to has been looking at modeling a lot of the commonly cited interventions in this space, and
Mhm,
kind of modeling out what's the impact of these interventions, not just from a financial perspective, but from a climate perspective, and
mhm.
how does that impact change depending on what kind of hospital are you. So what inventions are most impactful for a large academic hospital to implement versus a much smaller rural hospital to implement, and kind of through all of that, kind of
Mhm.
assessing which ones are the kind of most bang for your buck interventions.
Could you tell me a little bit more about those interventions that you just mentioned?
Yeah. So So we're looking at quite a few different ones, and they kind of range from the whole spectrum of different aspects of this. And it kind of touches on the other questions of the individual impact, right? Some of these
Mhm.
interventions include changing inhalers from meter dose to dry powder, and other interventions include like anesthetic gas use, and other things include like the food options at a hospital cafeteria. And um, for instance, a lot of these things are cited as, really useful interventions, but it's hard to kind of tell um, from a hospital administration perspective, which of these interventions is financially most helpful and also more like impactful based on the size of my hospital. And the preliminary work is still being done, and we're still in the process of finalizing all of our results. But some of the kind of insights from this were, of course, the most direct impact from like an accounting perspective would be buying credits, but that's kind of an arbitrary, um, you know, arbitrary impact on actual climate emissions. But the other stuff, including like, whether it's like remote commuting options or remote work options, sorry, or telemedicine and things such as, kind of moving away from inhaled anesthetic gases, can really have an impact, especially as like a kind of a bigger hospital has more surgeries, for instance, and kind of seeing how well that intervention scales has been some of the key insights that we've gotten out of this study.
It's a really interesting perspective. I have yet actually to think about the difference between how an intervention would work for a bigger academic center versus a rural settings.
Think also, sorry to kind of chime in here, but we've also been looking at stuff more local to the school itself. Last year, as part of the kind of local student org, we've piloted this program where we would incentivize student orgs to have a default vegetarian option, in order in exchange for giving some extra funding for buying food and so forth. And it wasn't necessarily that you had to order vegetarian food or vegan food for that matter, but it was just the default option. You just had to opt out if you didn't want vegetarian food. And we ran that experiment and that kind of grant, and now we're analyzing kind of the impact that it's had on spending habits. And so I'm really interested in kind of seeing how it plays out, not just from the big hospital level, but even from student org perspectives as well.
Could you tell me a little bit more about your school-specific student organization?
Yeah. So um, So at our school, we call the organization Students for Environmental Action in Medicine. The acronym is SEAM. And I like to describe SEAM as kind of a central hub for a lot of different things within the climate space. The biggest thing that we've done historically has been implementing a climate and health um, kind of curricular integration that has kind of been formally adopted by the school into the first year or preclinical curriculum. We also have done stuff in terms of um, linking people to opportunities in the space or advocating with community or partners who are interested in working on sustainability issues with the med school and hospitals as well.
Could you explain what you mean by when you say, like, integrating, environmental, like, consciousness and things like that into the school's curriculum?
Yeah. So this is something that I've been a little bit more involved with kind of in overseeing. And so at our school, we have a lot of case-based learning. So if there's a particular topic, there'll be a case written about it, and then students kind of work through that case together, and kind of work through the pathophysiology and treatment and so forth. And a lot of our integrations focus on the intersection of these cases as they are into climate stuff. And so, kind of a few examples off the top of my head is within microbiology. There's a very straightforward connection between climate and conditions such as Lyme disease or malaria in terms of discussing how the geographic territory of a lot of these vectors has increased and the temporal kind of risk period has also increased due to rising global temperatures. But there's also other integrations kind of more in the cardiovascular pulmonary space in terms of air pollution. And we've also been able to introduce a session on environmental ethics in some of our other classes, and kind of able to kind of spark a lot of conversations from the like student actively participating perspective. And then there's also a few like guest lectures throughout the year, um, kind of where we bring in speakers who are leaders in the space to kind of discuss their work in climate space.
That's really cool. In my research coming up for this podcast and creating it, I've seen a lot of stuff about integrating environmentally conscious things into curriculum and things like that. But this is the first time actually hearing about what that looks like. And so thank you for that perspective. From a personal perspective, moving forward, what are some of your goals kind of in this space that you have for yourself or like your impact and things like that?
Yeah, there's quite a few goals kind of at different levels. I think locally there's an advocacy project that's working on with a local power plant that's kind of within the hospital area, which is surprising, but there is a power plant kind of in the middle of all the hospitals. And so I've been kind of following along the advocacy work with that, and I hope that, hopefully at some point by the time I finish medical school, that we can kind of take a very concrete step forward and working on that in terms of reducing the pollution there. I think from a perspective on like medicines for sustainable future, I think a lot of my goals are really centered around um, kind of building a system where we can discuss a lot of like new approaches to delivering healthcare, and really kind of disseminating these ideas around and making them more accessible to people who are working in the actual implementation of a lot of things behind the scenes within the hospitals. I think a lot of these discussions can be theoretical, but require a lot of like practical input from uh, maintenance or like building managers and so forth. So I think that's another goal of mine. And then kind of in like for me personally, I kind of hope to have this climate sustainability work as like a kind of component of my career moving forward. And I hope to kind of keep that, and kind of regardless of what specialty I'd go into, there's always a connection to climate. And so I hope to kind of keep continuing this work in whatever way I can.
That's awesome. It's kind of surprising to think about that in a city there's a power plant kind of in the middle of a kind of hospital system. So,
Yeah.
um, but yeah, it's kind of weird. I also just wanted to kind of hear your perspective. So I am an undergraduate at the University of South Carolina. I'm starting med school in the fall, and I'm also in the background getting my degree in public health. So I kind of wanted to hear a little bit about how your background in public health and what you're doing now, more at the individual kind of medical level, how those perspectives are helping you in your work with the climate,
Yeah.
change and sustainability?
Yeah. I think I used to joke in undergrad that you can point to almost anything in the world, and there is some connection to public health associated with it. Basically, it's all public health, and I think that perspective has been helpful because it really has kind of imparted this mindset of pulling influences from kind of wherever and anywhere. A lot of the work that I've been doing has been possible because of kind of collaborating with people that you may not think of like first of mind when it comes to these problems. I think, for instance, if I didn't have this public health perspective of, oh, well, public health kind of touches everything, I don't think I would have kind of worked or signed up to work in an architecture lab and then use that as a connection point into urban modeling and so forth, which is very important to kind of understand the nature of climate impacts on cities and so forth. So I think that perspective has been really helpful, and being flexible and really kind of opening and being curious about um, how how working with everyone, regardless of whatever field they're in, how there is a role kind of for everyone in this work.
I totally agree. I hear that all the time in my public health courses too. Like everything is public health, and also in a few of the environmental health classes I've taken, you kind of everything is kind of public health and everything connects back to our environment and where we live. Well, that is all the questions I have for you today. Thank you
Yeah.
so much for taking time out of your busy schedule and being a part of this podcast.
Yeah. Thank you for having me.
Of course. As you've all just heard, Akhil embodies the idea of an aspiring leader in the fight for climate smart healthcare. And he got to his position simply by being curious and then getting involved. This is something that all of us, from future practitioners and leaders to present and future consumers of health care, can do. Be curious and get involved. In order to promote sustainability in healthcare, organizations such as MS4SF need our involvement to disseminate pertinent information and promote change. Our voices are a powerful tool, and I hope that from what you've heard today from Akhil and overall so far during the course of Polluting Patients has ignited some curiosity and a desire to take action. And with that, thanks for listening to Polluting Patients. Remember, a healthier planet is a prescription for healthier people. Keep pushing for sustainability in healthcare. See you next time.